Hey guys, in today's video, I'll be talking about what women can expect after having a C-section. I'll be talking about some things they can expect from their healthcare providers, that's their doctors, their labor and delivery nurses, or their midwives. The image behind me shows a mom who just had a C-section. You can tell by the priceless smile on her face as she's trying to reach out to her newborn baby. So after the doctor must have extracted the baby in the theater and handed over to the labor and delivery nurse or the midwife, they have to present the baby to the mom immediately. Before the procedure, a lot of pregnant women are always so anxious or excited to see their baby. So, in order to help bring down that anxiety, you need to present the baby to the mom in the theater, especially if the baby came out in good condition. So, after this stage, we are taking the woman to the maternity ward, specifically the surgical ward in the maternity ward. And we are expecting that in some hours time, depending on the kind of anesthesia that was used, this woman will start feeling pains. And what we are expecting from the doctor who did the surgery is that the doctor must have prescribed some some medications depending on how the surgery went. And the common medications are always on the list is antibiotics, which are being given to prevent infections, and analgesics, which are being given, that's painkillers, which are being given to prevent this woman from feeling a lot of pains. And we are also expecting the nurses or the midwives to follow this prescription accordingly. And the healthcare team in charge of taking care of this woman needs to create a vital signs chart for her. They need to monitor her blood pressure, pulse, respiratory rate, and probably oxygen saturation routinely. And the next thing is that in about 12 to 24 hours time at most, this woman has to receive a bed bath, a professional bed bath. Any institution that encourages carers to give patients bed bath or to give bed bath to patients who had surgeries, that's wrong. That's wrong. Especially day one of surgery. We are not expecting any carer to give that woman a bed bath. The bed bath has to be given by a trained professional, in this case, the labor and delivery nurse or the midwife, because they have the knowledge. In the process of giving that bed bath, they have to probably examine the uterus abdominally, massage it to see if it's well contracted. Because if it's not contracting, this woman is going to bleed the more. Normally, she has to bleed, but if the uterus is not contracting, she's going to bleed more. So, in the process of giving that bed bath, there are a lot of things that the labor and delivery nurse or the midwives they are going to examine and see. And after that, that's after the bed bath, you need to encourage the labor and delivery nurse or the trained healthcare professionals. They need to encourage this mother to ambulate. That's they need to encourage movement, because movement is going to promote blood circulation, which is in turn going to promote healing. We know it's not easy. Have you seen a CS wound? It's so deep and so big and so painful. I can only imagine. So it's never easy for them to get up from bed and ambulate, but you need to encourage it. You need to also encourage ambulation in bed. If she wants to turn to her left side, let her do it on her own. Don't help her. That's another form of ambulation. So guys, I hope this video was helpful. Please like the video, share the video, and I hope to see you all in my next video.